recording now, and then that recording will be sent out sometime tomorrow. So if you want to go back and review any of the information that's shared this evening, you can always go back and check that recording. Also attached to that recording is going to be a brief questionnaire. Should take you no more than 5 minutes. We just ask that you provide us with some feedback and fill that out. So keep an eye out for that email. Like I said, it'll come out sometime tomorrow. During the session, everybody is muted, but we will have a designated Q&A at the end of the session. During that time, what I will do is I'll allow everybody to come off mute if you want to ask your question, or if you prefer, you can always ask a question in the chat. But I would keep those questions until the very end when we do have the Q&A session. So from here, what I'm going to do is I'm going to pass it off to Sarah. Sarah, the floor is yours.
Hi, everybody. Thank you so much for joining us to learn a little bit more about DSHS and what it's like to work for us. Either as a student, we have a lot of great internship positions, or after. And so we'll talk a little bit about what it's like to work while you're in school with our agency, but we're also going to talk about navigating our job board because it can be a little complicated. It's definitely not the most tech savvy or intuitive system, so we always like to give a brief overview of that so that if you're in a position where you're wanting to apply for jobs after graduation with our agency, you'll kind of have a head start on knowing how that all works. So for a little bit of background, I am a program specialist within the Office of Practice and Learning. That is within the Department of State Health Services, which is referred to as DSHS. Our sister organization is HHSC, so the Health and Human Services Commission. And so the main difference between these two kind of sister agencies, we call them, is DSHS is more of your operational side. We house a lot of data analytics and program-oriented workforce development groups. And so that's what my office does. We manage policy, but we also manage workforce development within health and public health. And we'll go into that a little bit more later. But then when you're looking at HHSC, that's going to be your more programmatic side, kind of looking at the public facing programs that DSH does. So I'm with DSHS and the Office of Practice and Learning. And so I'm just going to make sure. There we go. So I kind of gave an overview. We're going to talk about different career opportunities and how to apply to work with Department of State Health Services if you're interested. But let's kind of go over the basics. So a lot of you are probably in public health, or if you're here, you're interested in working in public health, but we always try to give an overview of what that looks like. And so a really good way of describing that is we are your super macro kind of overarching agency, and we look at health from a population level, whereas your doctor, if you're going to see a physician, they're going to be looking on that micro person-to-person level. We're dealing with a city or a locality, something like that. And so it usually involves more so policy and initiatives that are enacted to improve the health of an overall group. So I talked a little bit about this, but some of these examples of what HHSC does, Medicaid, SNAP, CHIP, WIC, as well as the state hospital system, those are all under HHSC. And again, DSHS is going to be your more operational side. Another really important side of what we do is communications. So kind of getting an idea of the differences between the two agencies. And so looking at the approach of public health, this is kind of how we look at a lot of the issues that are brought to our agency when we're looking at the health of Texans overall. So first, looking at surveillance, identifying a problem, identifying the cause, identifying an intervention, and then implementing it. And so as you see, it kind of goes from the problem to the response. And that's kind of how we approach all of the work that we do with HHSC. And so this is just kind of like a web example of all of the different groups that we work with. So something I really like about my job is I have worked in the past for nonprofits, for more directly policy related groups. But working for DSHS allows me to kind of have a hand in all of those buckets. We have a very overarching and wide reaching breadth of work that we do. And so as you can see here, we're working with doctors more individually, working with hospitals, schools, civic groups, environmental health and environmental risk factors. And so you're able to kind of get exposed to a lot of these different organizations and different ways of working in public health just by having a position within DSHS. And I think a lot of people find that really appealing from an early career standpoint, because if you're interested in public health, but you don't really know in what way, working for a state agency is a really good way to get exposed to all of those different public health individual groups all at once. So now we're going to kind of look at an overview of our specific agency within DSHS. So our roles, we are a leader, a source of knowledge. We do a lot of, we advise HHSC, that's what I was looking for. And everything that we do is in pursuit of a healthy Texas. And so again, we focus on public and population health, and our mission is to improve the health, safety, and well-being of Texans through good stewardship of public resources and a focus on core public health functions. And so now looking at who we serve in Texas, Texas is really, really big, as a lot of us know. There are 30 million inhabitants, and all of them are impacted in some way by the work that DSHS does. We are a highly diverse population. We have the highest uninsured rate in the US and the largest rural population. So a lot of the work that our different regions within DSHS and within our more kind of micro-focused regions, they're trying to reach people who live in these rural regions who might be uninsured, and trying to ensure that everybody has access to being healthy. Again, you're seeing 17% live below the poverty level, so that's looking across socioeconomic status as well. So this is just kind of, I think that text is probably too small to even be able to read all of these, but this is an idea of what our staffing structure looks like. So regardless of kind of where you are on this, you can be involved in programs and initiatives that involve everybody all the way up to the executive commissioner. It really just depends on the type of work you're doing. But I think that's another thing that's really interesting about working for a state agency is that they do a really good job at bringing everybody in, regardless of if you've been with the agency for 1 year, if you're an intern, or if you are the medical director. There are always opportunities to kind of network with those people and get to know everybody. And we are a giant organization, so there are so many network opportunities, really countless. And so looking at our structure again, so from the operational side, we hold the financial office, which does a lot of work with the state budget office, looking at policy, while also managing the finances for all of DSHS and HHSC throughout the state of Texas. The Center of Public Health Policy and Practice, which is where my office is housed, and the Chief of Staff. And then looking at the programmatic side, we do a lot of work with epidemiology, which again is going to be data and lab work. Something a lot of people don't know is that Texas has the second largest lab in the United States, only second to the CDC's lab. And so we do a lot of really interesting work there. And regardless, again, of where you are in the agency, you can get a lot of exposure to the work that's done in the lab, which is really great. We have our regional and local health operations. So those are all of the different regions that are within Texas. There are 8 of them. Consumer protection, community health improvement. So those are all of our program sides, and we'll kind of go into those a little bit more as well. So this is an example of our regions. So you can see we have 1, 2, 3. The numbering is kind of weird. It's just kind of evolved this way. But 4, 5, 6, 5, 7, 8, 9, 10, and 11. So those are all of the different regions we serve. And each region has their own team that's kind of carrying out these individual initiatives that's a little more tailored to the needs of that specific region. And so responsibilities include just filling service gaps throughout the state. Texas is what's referred to as a home rule state. If you don't know what that is, it means that regions are able to enact their own public health initiatives. And so if they have the resources to, let's say, handle tuberculosis cases or to handle education around STIs and STDs, then they're able to do that on their own. If not, they can defer that to the state. And so DSHS and our more central operations will take on the cases that they don't have the bandwidth to do on their own. And so I mentioned like tuberculosis, Hansen's disease. A lot of those are carried out in our hospitals here in our central office. We have a lot of really great nurses and doctors who study that at the Texas Center for Infectious Disease. And so that's a really good example of something that requires a lot of bandwidth that really our central office only has the ability to carry out, but our regional offices do a lot of really important work on their own. So there's more examples here, like doing public health preparedness and emergency response. Our team down in Houston has a lot of environmental protection factors in place, natural disasters, emergency events, and then working with children, youth, and adults with special healthcare needs. So we talked a little bit about disaster preparedness. Our team in Houston is really familiar with this because of the different natural disasters that they come across, but our regional teams there discuss evacuation routes, different types of plans for natural disasters, unpredictable incidents, mental health response, as well as providing weather updates to keep people safe and healthy in the event of an emergency. And so this is just an example of some of the other on the ground public health responses and services and programs that our regional teams often carry out. I mentioned HIV and STD before. Zoonosis control really just means like animal-borne illnesses, tuberculosis, immunizations, and the list goes on. But here's some just really good examples of the different work that we do. So I won't go super in depth on our different regional profiles because we could probably fill an entire other slideshow with just that. But we have PHR1. So the regional HQ here is Lubbock and Amarillo. Our region 2-3, the HQ is going to be Fort Worth. 4-5 North has an HQ in Tyler. 6-5 South is in Houston. 7 is Temple, and so that is what Austin is located inside of. So if you're looking at regional, so our office is based in Austin. If you're looking at regional responses, that's going to be managed outside of our Temple HQ. But if you're looking at statewide services, those are all managed out of Austin. Region 8 has an headquarters in San Antonio, and 9-10 is El Paso Midland, 11 is Harlingen. So a really important group that's within DSHS is going to be the Health Statistics and Informatics group. And so one really good example of what they do is that during the coronavirus pandemic, and you can see it in the bottom right of the corner here, but they created this tracking system that was updated twice a day, and oftentimes by interns and people who were working on our data teams. They would take in all of the new confirmed cases, all of the new fatalities, and they would report them out to the state of Texas while also working with the CDC to ensure that our numbers were correct on a nationwide scale. And so we've talked a lot with different interns that have worked on our data teams, and they were all really impressed throughout their time of how important it felt like their work was, and the fact that they weren't just answering phones or answering emails, but instead were doing work that felt really substantive and mattered. And I think that's something that a lot of the interns that work with DSHS find is that when you work for a state agency, there's just so much to be done that anytime there's another person on your team, they typically are getting work that that feels meaningful. And so I think interns oftentimes are really impressed and feel very satisfied at the end of their internship that they did work that was important rather than just administrative work. And of course, some of them will have some element of that, but definitely won't be all of it. So looking at infectious disease surveillance, they collect infectious disease data. So kind of looking at that COVID tracking system I showed, they prevent, detect, and control these diseases. They operate vaccine programs and then conduct investigations and disease interventions. Another thing we do is work to improve HIV diagnosis. And so they work in our lab to apply testing practices in both clinical and then in community settings. They develop systems to make testing accessible to all people, not just in your more traditional clinical-based settings, but also in non-traditional settings. For example, we have here testing yourself and allowing people to do testing more privately. And as well to establish ways to regularly rescreen people who are at an increased risk. So that's what a lot of our programming around HIV diagnosis looks like. Our oral rabies vaccination program is something that we talk a lot about in our Austin office, specifically because our rabies program is one of the most expansive in the country, and that is because in Austin, we have the highest number of bats. We have that giant bat colony that lives underneath the South Congress Bridge. And because of that, specifically within our central office, we do a lot of programming around rabies, not just information so that people stay educated, but also prevention and programs to keep the bat safe so that if something happens where a person comes in contact with a bat, or example, we talk about gray foxes in this slide, then that doesn't injure anybody and people stay healthy through that way. So kind of looking at our lab, a lot of really interesting work happens here. So if you're somebody who is a bio major or is more interested in the really like specific science side of public health, you'd probably be really interested in our lab. Like is listed here, we do a lot of our community health improvement work there, as well as chronic disease prevention. We do testing on newborns and manage the newborn registry. So every newborn baby that's born in a Texas hospital gets a pinprick of blood that's then sent to our lab and tested for a bunch of different genetic diseases to ensure that those are identified as soon as possible. And that all of the children in Texas are kept safe. So that's something I find really interesting. But they also do a lot of work on chronic disease, tobacco use, injury, and ensuring that the environment around us is healthy as well. So testing water and testing air, that's all stuff that happens in our lab. So I talked a little bit about this, but maternal health in Texas. So we have a whole department that's just focused on maternal and child health. They do a lot of different programming. So one example is our maternal mortality and morbidity review committee, our Texas Mother Friendly Worksite program, and then Help Me Grow Texas is a really interesting one that has been developed over the years. So we'll go ahead and skip over that one. So looking at consumer protection, this is another area that I think a lot of interns find interesting, that maybe when they think of the work that our agency does, it's not the first thing that comes to mind. But this is, again, more testing that happens in the lab. It goes over drug safety, environmental health, emergency medical services, so EMS services, and trauma systems, as well as food safety and radiation control. So a lot of the testing that happens there is if there is a suspicious or a potentially dangerous substance that's in the public environment, it goes to our lab and it's tested there. So one example, I think that was on the next slide, but on that first slide where we talked about the lab, there was a picture of a face cream. And so we always use that as an example because it was a face cream that actually had really high levels of mercury in it. And people didn't realize that when it was first distributed out to the general public. But when people had bad reactions to it, it was then sent to our lab, and those studies were conducted by our environmental health and environmental protection teams. So that's just one kind of real life example of the work that our lab does, which I think is really interesting. Again, kind of looking at the different operational support that our team does within DSHS, we have our finance division, our chief of staff, program operations, and again, the team that the Office of Practice and Learning, where I work, is housed under, which is the Center for Public Health Policy and Practice. So we coordinate with HHS. While DSHS and HHS are two different agencies, we do a lot of work together. For example, we share the same legal team and we share the same IT support team, but we are technically two separate agencies. They're responsible for program oversight as well as agency operations and provide leadership for initiatives, strategic planning, and policy development. And then, like I mentioned before, our finance division, as well as the Center for Public Health Policy and Practice, both do a lot of work with the legislators. And so since we are in leg session right now, they're very hard at work kind of managing the different bills that are being passed and discussed and how they'll affect our agency. Something else we do is external relations. So especially within my team, since we do a lot of workforce development, academic engagement like this, we kind of deal heavily with communications and external relations. One example that's listed here is the legislature. So staying up to date on different bills and informing people on how that might affect them and their access to health. As well as a Healthy Texas, which we have a YouTube channel for, and it includes a lot of resources on how to stay healthy and different public health initiatives that are happening throughout the state. We also have our policy and workforce development. So here we, of course, cover health policy, workforce training and education. Again, like I mentioned, university partnerships, as well as early career programs. So two examples of those early career programs for people who are just starting out in public health, which oftentimes is people who are getting their degree. One is our internship program. So that's a really great program for if you're wanting to kind of get a taste of what it's like to work for DSHS while you're in school. You can be an intern. Right now, we've just concluded our recruiting for our summer session, and then we'll be taking another cohort in the fall. So if you're interested in applying to be a part of that cohort, I definitely recommend checking in with our website. In June or July is probably when a lot of those listings will go up. But those will be for our fall interns. And the other example is the fellowship program. And so if you are about to graduate, or if you are going to graduate in a year and you want to kind of put a pin in this for later, the fellowship program is specifically tailored to early career individuals who are interested in public health, as well as people who maybe started one career path but want to switch to public health but don't have a lot of experience in that space. A lot of feedback we in the Academic Engagement Center have learned is that people are going to apply to jobs that say it's entry level, but it requires 1 to 2 years of experience, which can be really frustrating. And so the fellowship program is kind of meant to bridge that gap. And so if you apply and you get an interview, you'll be matched with a few of our regions, as well as different programs throughout the state take on fellows, and you can go work for them for a year. It's a salaried position, full-time, 40 hours a week. You get benefits, everything, but it's a contract position, so it's only meant to go for a year. And then after that, the idea is you can go work in the public health workforce and kind of have that baseline experience that you need to be really marketable in the job force. So we talked a little bit about the internships. We follow the academic schedule. So there are fall, spring, and summer opportunities. Like I said, we're in the summer session right now, but we will be taking applications in just a few months for the fall session. There's a lot of projects based work, but we also have a really heavy emphasis on networking and ensuring that all of our interns have good exposure to the entire agency so that they can get an idea of what it's like to work for DSHS outside of just their host team. It is an online application process. So if you just go to our website, Texas DSHS or Department of State Health Services, within the Office of Practice and Learning, you can find all of our information as well as the link to apply for internships there. So here we just have some kind of high level ways to make the most of your internship. I'm sure since a lot of you are attending a, excuse me, attending an academic engagement seminar, you've heard a lot of these before, but I'll kind of like read through these a little bit, but they're pretty basic. It's communicating, learning how to fit in, and then do work that's beyond what's asked of you so that you stand out to some degree. Always asking how you can help your team, being a good resource, but also being willing to ask questions, and really committing to networking. And so that's something that we stress a lot and that we do a lot for our interns is create these opportunities for networking, because we know how important that is to getting a job once you leave our internship program. So we talked a little bit about the Texas Public Health Fellowship, but this kind of goes over just the really top level elements. So it is a paid training program that focuses on professional development while also giving you real world experience. So this is the sometimes dreaded HHS job board. We do have throughout the year sessions with our team where we'll kind of go through and give examples of how to navigate this in real time. So we'll go over to the job board and kind of show you how to manage the keywords and the different filters to ensure you're getting a search result that's applicable to what you want to do and to what your career goals are. But as you can see, I mean, the different job openings are really vast. We always recommend starting by focusing down on city. So if there's a city that you know you want to work in, starting there, going into the category, and then of course adding in keywords. So for example, I got my master's in public affairs, so essentially policy. And so when I was looking at jobs, I typed in the keyword policy, and that sent me to the position I'm in now because we're housed under the Center for Public Health Policy and Practice. So I definitely always encourage people to start with as many keywords as seem to fit. And then if you type in a bunch of keywords, you only get 3 answers and you apply to those ones, then you can just start gradually removing keywords so that you're able to kind of expand that search. But at any given time, there are hundreds of job openings. So we always encourage people to start with as narrow of a focus as possible and then kind of broadening it from there. So then looking over public health skills, these are just some of the skills that we find when people are hiring within our agency, what they look for. So communication is really important, having good both written and verbal skills. Being able to collaborate with diverse stakeholders. I kind of mentioned before, if you remember that web slide, when you're working for our state agency, you are probably going to be asked at some point to work with any of those groups or agencies or individuals. And so people who are within DSHS and who are hiring for positions want to make sure that if you're coming to work for our agency, you're able to work with a bunch of different people in a really effective way. Technical and quantitative background, the length of quantitative really depends on what department you're going to be in. So for example, my position or my office is much less quantitatively focused. But if you're looking at positions within the lab or within epidemiology, a lot of those are more data focused. And so are going to ask that you have a lot more of that kind of hard data experience. experience with evaluation and assessment, financial management, and then legislative and government processes. So especially within our department, so the Office of Practice and Learning within Public Health Policy and Practice, some knowledge about the legislative and government processes is always encouraged. And so another important thing to note is we say here, does your resume or application match your desired job? It's always really important if you are applying to a specific job to kind of tailor your resume to that. And so highlighting a lot of these both soft and hard skills is really important as you're going into any job interview, but especially with a big state agency where you may be applying to 3 of our jobs all at once, then it's definitely worth your time to go through and kind of tailor your resume towards that. We also ask for cover letters for all of our positions, especially and including our internship positions. And so really ensuring that you have a strong cover letter that shows and demonstrates that you have all of these skills and kind of how you have them is also really important, because a lot of our host sites or host programs who take on these entry-level roles or take on interns really put a lot of weight into that cover letter. So it's really important to kind of use that to show your strengths, but also show that you are a really good written communicator and that you know how to kind of sell yourself and you know what your strengths are. So I'll just leave this up as we do questions, but we have a post-assessment survey that we like for people to answer. And as you're kind of going through it, it will also give you more information about some of our programs. So it's definitely worth your while. I'm just going to go forward and then I'll go back to this slide real quick. But here you have our education programs manager's contact information. His name is Craig Gilden. So he's a really good resource if you need someone to reach out to. My name is Sarah Hamill, and you can reach anyone on our team at internships@dshs.texas.gov. That's kind of our catch-all email, and it goes to all of our inboxes. And we're always more than happy to kind of create that time for more one-on-one participation or one-on-one guidance. If you are thinking about joining our internship program or you just want to have a networking opportunity with one of our staff members, we're always more than happy to set that up. So I'm just going to leave this post-assessment up. Feel free to complete it whenever you have some free time. But if there are any questions, I would love to kind of head into that.
And just a reminder to everyone as you're thinking of those questions for Sarah, you can either post your questions in the chat or you can also come off mute. You do have the ability to come off mute and ask any questions. So feel free to do so.
And if you think of any questions kind of later on, again, you're always more than welcome. I can put that email in the chat box, but we have a lot of people who attend sessions like these and then think of a question like the next day or a couple days later. You're always welcome to put it in there in that inbox as well.
Sarah, I have a question. As people are going through and applying for positions, and let's say they do land an interview, what does that interview process look like generally?
Yeah, so looking at internships specifically, we have a kind of SurveyMonkey link that is more of a catch-all application. And so you go in and apply and you'll list off typically 3 internships that you would be most interested in. That's going to be from a pool of somewhere between 30 to 40 internship positions that we have available in any given semester. And then there's also an opportunity to check a box that says, I am interested in any internship for which I'm qualified. And so a lot of people go ahead and click that as well. And so in that case, if you're selected for an internship interview, you'll receive an email from that host site or host department directly. They'll set it up. Typically, the way internships go, it's a little more casual. And so it's really just about getting to know you and your experience. It's a really good opportunity for you to just, again, talk about your strengths and the different skills that you have in public health, but also because it's an internship and we know that you're just kind of developing these skills as you go through school, it's a really good opportunity to talk about what your goals are and the different strengths and skills that you want to develop as you kind of head through your internship. And so we have a lot of people who go into internship program interviews and they don't want to talk about any of their weaknesses or gaps in their resume, but we always really encourage people to look at those gaps, so to speak, as opportunities. And so when you're in this interview, the person who's interviewing knows that you're still in school, knows that you're developing as you go through your career and kind of identifying what it is that you want to do and how you want to be involved in the public health workforce. So being really open with them about that and saying, you know, I have taken classes in data analytics in this way, but this is how I'm really interested in getting that hands-on experience. That's really important as well. And so we always tell people when you're going through that interview process, it is really meant more to just be a conversation to get to know one another and to make sure you're going to be a good fit for their team. But we always encourage people, again, when you're going through the application, to check that extra box that says, I'm interested in any internship that I'm qualified for, because if for whatever reason, the one you interviewed for isn't a good fit, you'll be reached out to by our team and we'll help link you to a host site that we think might be a better fit for you. And in that case, then you'll receive another interview with that team. Typically for internships, it's only one interview. Again, pretty casual. And if you're looking at a full-time position, that's going to be more like 2 interviews. But we always try to keep them very casual and just, it's really just identifying not only if you're a good fit for the position you're interviewing for, but if that position is a good fit for you and your goals as well, which is important to keep in mind as you go into any interview.
Thank you. That was fantastic.
Hi, Sarah.
Hi.
Oh, yes, I'm sorry I came in very late. You
That's okay.
mentioned something. Oh, you mentioned something when I came in that if one had wants to have an experience with an employer, that there's something like that or something. Did I get that right?
Yeah, so you're probably referring to a lot of the networking opportunities that my department facilitates. And so if you missed the introduction, I work with the Office of Practice and Learning. And so our goal and our main job is to connect people from the public to different departments and groups within DSHS and HHSC. And so one way we do that, if you reach out to internships at dshs.texas.gov, that email I put into the chat box, and you say, I want to learn more about maternal and child health, for example, we can connect you to someone from the maternal and child health team so that you can ask them questions and kind of learn from them about what it's like to work for DSHS and what their day-to-day looks like, any of those sorts of questions. We'll be happy to make those connections. But definitely the first step, if that's something you're interested in, is just reaching out to that catch-all email that I put in the chat, and then we can go forward from there.
That's internship at dshs.com, right?
Yes. Mm-hmm.
Oh, the internship is that with an S or something.
Yes. Yeah. Internships at dshs.texas.gov.
Thank you.
Of course.
Again, if you do have questions, you can come off mute, or if you want to post them in the chat, please post them in the chat feature and we'll be able to answer them.
So another question we got was, what happens after the job close date? Are interviews conducted before this time? So typically that isn't necessarily a hard date. We usually give people the guidance that they should set their job close date to when they're hoping to hire someone into that role. When you're looking at our internships and our fellowships, we always tell people that as long as the job is posted and that it's viewable, then it's available. And that typically applies to our job board as well. If someone is hired into that role, then typically it gets removed from the job board. So when you're looking at that job close date, it's usually more of a goal to where they'll cut off taking applications and then start reviewing them. But we always encourage people, if that's a role you're really interested in, reach out to the hiring manager or reach out to our team with your resume and your cover letter and just try to get it in front of somebody, because it could be that they go through all of their applications and they don't really find a good fit and they end up taking those applications on more of a rolling basis. That happens a lot as well. So definitely I would say that job close date is always kind of a recommendation more so than a rule. And so as long as it's listed and you're able to apply to it, I always recommend just trying to put your name out there if it's something you're really excited about. So we have another question. I'm trying to make sure I'm understanding this correctly. Maybe your team from your university will have more to say on this, but do internships with HHS comply with affiliation agreements? I know that from our side, we do have affiliate agreements with a lot of the universities that we work with. If we do take internships from that school, typically we have an affiliation agreement. But it's really easy for us to put those together if there is a school that we don't have one for. And so ensuring compliance with that typically isn't a barrier or an issue. I don't know if y'all have anything to add to that, but
I believe we do
yeah.
have an affiliation agreement. So I would just double check on that with that department that handles those setting up those internship opportunities. Just double check with them, but I believe we do have that.
Great. So if someone else who said they are a student who is studying IT management, I would definitely say that you would have a shot at a position with Health and Human Services. Again, I kind of mentioned this before, but our IT department is located within HHSC. So when you're looking at the job board or different internship postings, we handle a lot of internships across DSHS and HHSC. But if you're looking at a full-time position with HHSC in an IT focused role, then it's definitely going to be on their side of the agency. But there are a lot of positions, especially entry-level ones, that are available there. It's just kind of managing the job board and checking in pretty frequently once you're ready to be applying to a job. And then just making sure, again, that your application and your cover letter is ready to kind of demonstrate your skills and what you're excited to learn. But yeah, we're always hiring people for our IT team. They, of course, because they cover HHSC as well as DSHS. Again, I can't stress or emphasize how giant of an organization we are. They have a lot of work to do, and so they're always hiring. So if someone else who is a student in healthcare management looking for internship opportunities. So I'm just double checking. So I had said that we closed our internship deadline. Our deadline is actually tomorrow. So if you are interested in internship opportunities for this summer, I definitely recommend, like tonight, going to our website. So it's within the Office of Practice and Learning of DSHS. Under the internships tab, you can find that application. We do have a lot of positions that kind of fall under healthcare management that is a really important role, or if that's your major, you're going to have a lot of applicable skills that'll apply to our internships, but also full-time roles within DSHS. So I definitely recommend, even if you're looking for the fall and you're not necessarily ready to apply for the summer, given that the deadline is tomorrow, it's a good idea to just kind of go and get an idea of what positions are available. Definitely there will be more in the fall than are up right now, because we do have some host sites who have already hired into their roles. And so because of that, we've taken some of the roles down from the internships tab, but it's still a good way to get an idea of kind of what's available. But definitely if you're studying healthcare management, then there are a lot of internship opportunities within that. So we have another person who is a recent grad with a BS in business management and manufacturing and distribution. I definitely think we have a lot of project manager roles. And so stressing again how important it is to have a cover letter that emphasizes the parts of your previous roles, your previous skills that apply to what you want to do. That's super important. And so definitely having a BS is really great for wanting to go into healthcare management, but also really focusing in on what it was like to be a project manager and the different skills that you developed as you were a project manager and the ways that you'd like to apply that to working in public health. All of those are really great ways to kind of show how the skills that you have from your BS can in business can transfer into public health. And so since you are a recent grad, I would recommend both applying to some of those full-time positions that we have available, but also in about 6 months or so this is sort of more long game, but our fellowship opportunities will be listed on our website as well. And so that's the program that I talked about a little bit earlier that's specifically meant for people who are early career looking to get into public health, either from school or from another industry. And so it sounds like you'd be a really good fit for that. And so kind of keeping an eye out for those is definitely a good idea as well. So someone else who is a student in advanced nursing education and community health. So that's awesome. I mean, all of this experience is great, but we do always have a lot of opportunities specifically for nurses or for people who are interested in educational opportunities within public health. I will always plug my department because we're really great. And so looking on our job board, you could look within the Office of Public Health Policy and Practice, which houses the Office of Practice and Learning. But one example of what we do is we manage continuing education for a lot of nurses throughout the state. And so that's one place that you could apply. You could also apply into any of our regional offices who do a ton of nursing and educational kind of health equity, but also just health promotion work. And they always look for former nurses or people with education backgrounds in nursing to go into those roles. So again, that's just going on to our more general job board and using those filters to the best of your ability to look for those types of jobs that are catered a little bit more towards nurses. But definitely if you have a background in nursing education and that's what you're interested in going into, I would say maybe if you're interested more in specifically community health, looking at our regional offices to start would probably be a good move. But there are going to be a lot of opportunities for you. It's just kind of figuring out how to manage the job board. So can you please show the last slide again? Yes, of course. I'm thinking we're meaning this one with Craig's contact information. I will say you can email him directly, but it's probably better that email that I put into the chat, the internships at dshs.texas.gov. That is probably going to be a better bet just because it goes to our whole team. And you might get a faster response. And probably it's going to be the same information, but it'll just get to you a little more quickly if it's going to 6 people versus just going to 1. But okay, can you please show the first slide that had the DSHS website on it? Yes, I can. That's our pre-survey. I think maybe it was later on. I don't know if there's a slide that has the website on it specifically, but if you just Google Texas Department of State Health Services, then our website will come up. So that again is where you're going to find our job board, as well as all of the information pertaining to the fellowship program and internships as well. Give me just 1 second. I'm going to drop that into the chat. Yeah, it's just www.dshs.texas.gov. But there we go. I just put it in there. And so you can kind of go through all the different corners of our website to find some of the stuff I was talking about. Okay, graduate with health information management degree. Awesome. You currently live in Arkansas. Are there remote positions for internships or fellowships available? So there are definitely. I know we just concluded with hiring for this current cohort of fellows that are going to start in June. There aren't a lot of them. There are some remote positions. I will say that typically, if you're working for a state agency, they prefer that you live in the state where the agency is located. I know that there are some regulations related to remote work. So originally from Texas, that's great. But what I was about to say is a lot of our agencies have the rule that you can only work for 30 days consecutively outside of the state of Texas. And so even if you're applying to a remote role, typically they will ask that you relocate to the state of Texas in order to be in that role. But you can always look for similar positions in any other state. I mean, I'm partial to saying that working for the state of Texas is a really great experience, but a lot of the different programs that we have are also offered through other state agencies as well. And a lot of the different initiatives and programs that our teams kind of enact throughout the state are also happening in other states too. So at that point, it's just kind of looking up the state that you're living in or the state that you're interested in moving to and their state health department, and Googling that and finding their website and doing a lot of the same stuff that I talked about. It's usually pretty consistent across state agencies. But for example, like we have someone who's fully remote on my team, but they live in Lubbock. And so they're just working for central office, which is HQ'd in Austin, but they still live within Texas. Great, well, I think is there an email group for alumni to send their cover letter to HHSC, specifically in finance? Not quite, but again, if you want to reach out to that internships email or contact anyone on our team with your cover letter or with your resume, we do a lot of work where we just connect people and connect hiring materials like that to respective departments that are hiring. And so it's not necessarily an email group per se. I don't know if your university has something more tailored towards that, but we kind of do that networking on behalf of people a lot as well.
All right. Well, Thank you, Sarah, for jumping on this evening, giving a
Yeah.
great presentation. Everyone, the emails that you can reach out to were listed in the chat, so make sure you're double checking that. Just a reminder, this was recorded and it'll be sent out tomorrow, so keep an eye out for that recording. And thanks again, Sarah, for jumping on and presenting.
Absolutely. Thank you, everybody who attended. We hope to hear from y'all soon.
All right, everyone, have a great evening.